Welcome to Health Nugget Media Channel, where we provide health-related nuggets and answer critical health questions to give valuable guides. Please, subscribe to this channel. Today's question we wish to address is, are intermittent fasting diets healthy? Intermittent fasting is one of the most popular diet trends today, with millions of people following different types of fasting schedules, including 16-8, 5-2, and alternate day fasting. But is it really healthy? According to a 2019 study published in the American Journal of Clinical Nutrition, intermittent fasting has been shown to improve weight loss, insulin sensitivity, and cardiovascular health markers. However, it's important to understand the effects of intermittent fasting on our bodies, especially for those with certain medical conditions. What are the benefits of intermittent fasting? According to a 2020 study published in the journal Nutrients, intermittent fasting has been shown to have a positive impact on weight loss, body composition, and cardiometabolic health. The same study also states that intermittent fasting can help improve insulin sensitivity, which can help prevent type 2 diabetes. A 2021 study published in the journal Nutrition Reviews found that intermittent fasting can improve heart health by reducing blood pressure, cholesterol levels, and inflammation. What are the risks and considerations? However, not everyone should follow an intermittent fasting diet. The American Heart Association states, people with a history of disordered eating or those who are underweight should avoid fasting diets. Additionally, people with certain medical conditions such as hypoglycemia, low blood pressure, or liver disease should also avoid intermittent fasting diets. A 2019 study published in the Journal of Nutritional Science warns that intermittent fasting can lead to nutrient deficiencies, decreased bone density, and increased stress levels. What is the best intermittent fasting method? According to a 2020 study published in the journal Nutrition Reviews, the best type of intermittent fasting for most people is the 16-8 method, where you fast for 16 hours and eat within an 8-hour window. The study also states that it's important to choose a fasting method that is sustainable and fits into your lifestyle. In conclusion, intermittent fasting can have positive effects on weight loss, insulin sensitivity, and heart health. However, it's important to consider individual needs and medical conditions before starting an intermittent fasting diet. As with any dietary change, it's always best to consult with a healthcare provider before beginning. Remember, the best way to maintain good health is to eat a balanced and nutritious diet, exercise regularly, and get enough sleep. Thank you for watching this video. Try to comment below and share this video. Please, don't forget to subscribe to this channel. Thank you once again.